Hello, I'm Erin Cox, physiotherapist. Today we're going to talk about the midcarpal and intercarpal joints. So the midcarpal and intercarpal joints. So the midcarpal acts as a joint complex as a functional sellar joint. And we'll look at that because we talked about the ulnar side being more convex, always on concave, and the radial side being concave on convex, which together makes it a functional sellar joint. So here we are here. So we said all of the proximal row is convex on concave, but as we go into the midcarpal area, we have the convex capitate and the convex hamate on the lunate and triquetrium. And on the radial side, we have the concave trapezium and trapezoid on the concave scaphoid. So the radial side is a convex distal surface of the scaphoid, articulates with the concave proximal surfaces of the trapezium and trapezoid. And on the ulnar side, the concave distal surfaces of the lunate and triquetrium articulate with the convex proximal surfaces of capitate and hamate. I tend to always name it by the distal row, or sorry, not the distal row, but the distal bone on the proximal, because that's how we tend to name the mobilizing. The intercarpals. So remember, Big Daddy in the middle, the capitate is convex all the way around. So on the proximal side, the trapezoid and trapezium are concave on the scaphoid. And the proximal side on the other side, it's also convex on concave. But don't forget, you've also got these longitudinal or the in-between. So if capitate is convex all the way around, then this means the hamate will be concave on the convex capitate. The lunate will also be concave on the convex capitate. And then on the other side, we have the trapezoid and the scaphoid being concave on the convex capitate. And those articulations will be important for our folding and fanning later on. Again, this is just another way to see it. And this is what we were talking about, this functional sellar, because of the combined movements. So when we want to do radial or ulnar deviation, some other movements have to happen in order for these to work as a functional sellar. And then, as I said, the capitate is convex all the way around. Now, if we look at the wrist ligaments, it's a complex network of interlocking collagen fascicles, and they're mostly capsular. The collagen fascicles fuse with the layers of the joint capsule. So they're intimately related, the ligaments and the capsule. And some then are intra-articular. So the functions of the wrist ligaments, they're going to limit the movement, but they're also going to guide translation. And also we have mechano input for function. A lack of interosseous ligaments between the proximal and distal rows allows increased freedom of midcarpal movement. And like we said, the midcarpal movement is greater than the radiocarpal. We have the short intercarpal, the intermediate intercarpal, and the long intercarpals. Palmar and dorsal for both the short and the long. And the intermediate intercarpals that may span one joint or more, and they control the joint movement. I want you to take note, though, we have that central articular pillar. So from the capitate and the third metacarpal and the third digit are sort of our central pillar, where those long intercarpal ligaments or those intercarpal ligaments will join in from the outside into the middle, into that pillar. So you can see it's starting to happen here. This is the dorsal intercarpal ligaments. But here we see on the palmar side how the ligaments are directed towards that medial column. And that medial column is going to be your most stable part. And this is what we're going to fold and fan around that mid-column. The mid-carpal joints is synovial, compound, because they're all in the same capsule, and a modified ovoid. The triquetrium hamate is a modified sellar. The intercarpal is synovial, compound, and planar. So the degrees of freedom, Flexion, extension, and radial ulnars. There's 2 degrees of freedom in the midcarpal and intercarpal joints. The closed pack position, midcarpal is neutral flexion extension to full extension. We talked about already the serial closed pack in another video. And intercarpal is extension. The resting position in the midcarpal, slight flexion with ulnar deviation. Again, that's about from here downwards. That's what we talk about. And intercarpal is neutral to slight flexion. The capsular pattern, equal restriction in all movements, and normal infill is capsular. Break time.